My name is Brian James, and welcome to my channel, Pre-Retirement Planning Without Savings. I hope everyone is doing well. If you're looking to get mixed reviews or information from real people concerning Medicare versus Medicare Advantage, you've come to the right place. On Facebook, I belong to a retirement chat group, and to protect everyone's right to privacy, I won't say the name of the group or the names of the participants who make or answer posts, okay? So first of all, since I have 6 years to go before I would have to get Medicare, I honestly have no idea about the things that people have been telling me in this Facebook thread. There's been a lot of good information in this thread, and definitely stuff I will want to look into and conduct more research on. I'm hoping that I can better advise my friend as to her own insurer and how they stand up against the competition. With the exception of needing insurer's permission to see a particular doctor or for a certain procedure to be done, her insurer seems pretty fair. And my pea-sized brain has been worried that she would pay her daily rate at the hospital plus her copay amounts for meds given, diagnostic services, labs, imaging, laboratory services, diagnostic radiology, etc. I say this because I did indeed receive her hospital bill, and I was greatly surprised, astonished really, that the insurance paid the entire bill except for her daily hospital charge. I couldn't believe it. It makes no sense to me. I did the math. At the current rate charged for Medicare, including the amount she pays for her Advantage RX Plus insurance, she would have to pay the system approximately 31 years without any costs for them to get back what was billed and paid on her behalf. Basically, I think the cost they show us on the bill is not nearly the amount that the government or insurer pays to the hospital. I really wish that we could see the amounts paid, but I'm not complaining. I felt she got the better end of the deal, and I made arrangements to pay her bill right away. Then, when I read all the comments in the Facebook thread, I found that maybe there are better plans out there still worth looking into. Maybe she wouldn't have had to pay anything if she had been on the right plan. I said to the Facebook chat group, this question concerns Medicare or Medicare Advantage with a private insurance. I'm curious about how much insurance covers for a 4-day stay at the hospital for an operation, and how much the patient has to pay. I help an 83-year young lady take care of herself, and she recently fractured her hip and snapped a bone in her knee or leg. She had the necessary operation. She is currently at a nursing rehab facility. I'm wondering if anyone has gone through anything similar, and what should be expected for the amount due for the patient. Is it just the deductible or that and other costs? Thanks in advance if anyone tries to answer this. Many of the answers were very helpful, and some were not expected at all. Person A replied, my mom had Medicare Advantage while in rehab. She was a fall risk. They had provided a caregiver at her bedside 24 hours a day. She was there 3 weeks. She was charged $0. I asked who the insurance company was because that's pretty incredible. And she said it might have been United Health in 2019. Person B said, I have Plan G and only pay my deductible. My supplement pays the 20% that Medicare does not pay. I'm not sure about rehab. Person C followed with, The shocking thing about Medicare is it isn't for long-term rehabilitation care. After 20 days, the copays are between $200 and $900 per day. I hope she recovers super quick. I feel these answers are pretty trustworthy because it's based on people's knowledge or real experiences. From here on, I will refrain from torturing you with the person D through person Z comments. However, I will compile all the answers into one big statement or a few big statements. Let's see what we get, but it might sound crazy, like a crazy person, so here we go. I used to do nursing home billing. Medicare Part A only pays 20 days at 100%. Starting day 21, there's a huge copay. Hopefully she has a supplement or Medicaid to pay the copay. Talk with a social worker to help you. Depends on what coverage she has. If she is on Advantage plan, that's different. If she is on traditional Medicare, she pays $1,700 deductible. Not the one my mother had, she paid $0. Medicare plus her supplement covered it all. My Medicare deductible is like $250, Plan G. Medicare pays 80%. Hopefully she has supplement that pays the other 20%. In this case, she will pay $0. Most Advantage plans have a daily copay, often around $300 to $400 for the first number of days of hospitalization. Number is usually 3 to 5 days. I have nothing good to say about Medicare Advantage or UHC. My father had a major stroke last year, and UHC said he didn't need rehab. Sent him home by himself. He wasn't. I had just retired, thankfully. Then had another mild one, again home rehab, and the man could barely walk. He's back on track now, thankfully. I have A and B and a supplement. I will stick with them. I have a Medicare UHC PPO plan through my state teacher retirement system. I have no deductible. Hospitalization is $100 per event, so $100 total for a surgery like that. If nursing rehab care is needed after the hospitalization, that is covered for the 90 days. Prices are different in every geography area and healthcare system. Medicare Advantage plans are accepted less and less depending on the part of the country that you live in. There is a deductible to meet each year, and the rest depends on the supplement you have. You should check some of that before the procedure. My husband was treated at Mayo Clinic for about 16 months, staying as long as 26 nights at a time, inpatient. We had Part A, B, and G. His invoice charges were approximately $3 million. We paid our deductible of approximately $250 each year and had approximately $200 in non-covered labs. Approximate total, $750. Just to be clear for everyone, your G plan is a supplement that you purchase to cover the 20% that straight Medicare does not, right? I just don't want people to think you meant C, which is the horrible, horrific Advantage Part C plan. My parents had straight Medicare Parts A, B, and Blue Cross Plan F that no longer exists. Now it's G, and they never paid a penny. Just a monthly Medicare, $176, and Blue Cross, $325, and it was worth every penny. That's $325. To the last part, I replied, yes, that is a cause of frustration, needing to get approval for everything. We have experienced that twice with her insurer. For now, they switched her off the Advantage plan to regular Medicare, claiming that was a better financial decision right now. If we don't switch her back, then she would need to get all new doctors again, which she just recently did this past year. That was frustrating in itself. Thanks. You've given me a lot to think about and to talk to her about. And this person again replied, not when you are 95 years old. She was very healthy until age 84. Then, over the next 11 years, she had 4 different cancers. And I made sure she got the absolute best doctors and best pharmaceuticals because she had a good Medigap policy. Other friends of hers had Advantage plans and were denied the newest medications and procedures, and her friends without a supplement plan were financially devastated by the 20% that Medicare doesn't cover. You just make it work out financially, because if you live to 80 or 90 years old without a good supplement, you may end up in trouble, and everyone needs a long-term care policy. And that had a double exclamation point. I took care of both of them. We are middle-income people, but made health coverage a priority over our new or fancy clothes. Over new cars or fancy clothes. It's all a choice. I'm in the medical field, and it's sad when people pick the cheapest plans and then they are denied care from the medical system. The next person said, yes, that is correct. It is Plan G. Many of the major hospitals like Mayo have stopped accepting Advantage plans, and some have even stopped taking Medicare patients. We are not able to get a primary doctor at the Florida Mayo. My mother had that Blue Cross coverage on the Oregon coast. They dropped it there too. She got a State Farm Plan G that the Florida Mayo accepted as well. She paid $0 for a 4-day inpatient. I had Part B, not Advantage, and it paid my $300,000 knee replacement, and I only owed $20. Geez, $20? That's it? That person was very lucky. You didn't know this would have been such a long thread, but that's what you get when good people respond to try to help a stranger out. But I'm no stranger than you are. Just kidding. Anyway, here are some more responses. There is no one answer. Plans are different, so coverage and reimbursements are different. Depends on the plan. What's the deductible out of pocket? That's likely what you'd pay with an Advantage plan. For traditional Medicare plus a supplement, you'd likely pay nothing. The answer to this question should be simple. The hoops we have to jump through to even get basic health care is ridiculous. Okay, I'm off my box. I've been through a few heart attacks and cancer. I've been well taken care of with my Medicare and Medicare supplement. Very little out of pocket, less than $500. There will be a person at the rehab likely already has that answer. What you want to be prepared for is that they don't push her out the door before she is ready. Well, believe me, she is ready. It's been a month with no rehab on her hip or leg, and she's sick of it. She is ready to go. Also depends on if in the hospital as an outpatient or inpatient, as well as the type of plan you have, with F, 0, with G, 0, after you have met your deductible. With Advantage or C plan, deductibles and copays are designated by the plan. Depends on your Medicare insurance plan. Simply put, you'll need to speak with social workers and or insurance advocate agent. Prayers for speedy recovery. The next person wrote 2 paragraphs, which is my own style, so I'll lay it out by itself. This question is complicated enough and depends to such a degree upon your area and plans available that it is best to consult with a good insurance agent specializing in Medicare supplements. Look for someone with extensive experience. The first one we went to was okay, but she was young and still learning the ropes and not that informative. The second one had been in the industry for 20 plus years, and was much better and helped us find the best policy for our area with doctors we wanted, etc. The big question is Advantage versus traditional supplement. Our area happens to have the best Advantage coverage in the nation, and we almost went that route. But in the end, we decided we could always switch to Advantage in the future, but not necessarily vice versa. They are not required to take you switching from Advantage to traditional. So since we're new to Medicare this year, I used it for the first time yesterday. We decided to start out with traditional supplement Plan G, and I suspect we'll stick with it because it's not that expensive in our area and avoids a degree of risk and uncertainty that comes with Advantage plans. And the responses continue. Depends on your policy. We have the top level and pay the gap, usually around $200. Varies depending on the hospital and the surgeon. Without specifics about her Medicare, whether a Medicare Advantage plan or Medicare A and B with a private supplement plan, there's no way to say what her out-of-pocket costs will be. The social workers at the rehab center would have the best insight about that. She can have skilled nursing for 20 days on the MA plan, then $100 or up to $200 a day on the MA for 100 days total. That's Medicare Advantage, probably. She can get skilled nursing up to 100 days on med supplements. Hopefully, she has long-term care plan in place. This is where I see it gets ugly, and most don't have long-term care. Medicare does not pay for that. Medicare agent for 21 years. It depends on which one she has. On my Advantage, last year I went to the emergency department, treated and discharged. 5 hours later, I went back to the emergency room and was admitted for 3 days. I only paid a couple $100 total for everything, including seeing several specialists for follow-up. Cardiologist, surgeon, GI, and my PCP. I suggest you call her particular carrier. Medicare and her supplement plan will cover 100% as long as her Part B deductible is paid. Medicare Advantage plans are scams. It depends entirely on what supplements or Medicare Advantage plan she has. If she has Plan F supplement, her cost should be $0. With a Medicare Advantage plan, she would have to pay the first 5 to 6 hospital days, physical therapy visits, some labs, tests, or x-rays, etc. Medicare Advantage plans are inexpensive, but you pay more if hospitalized. Now that makes sense. I have Medicare with a supplement. I broke my femur, spent 4 days in the hospital, and then to a skilled nursing facility for 30 days. My bill was $0. Medicare Advantage plans, I'm not sure about. They pay different and have copays for a lot of things. Depends on what she has. Does she have an Advantage plan? Each has different copays for hospital stays, etc. To which I responded, her friend wants her to switch to a plan that gives her the spending money each month. But I don't want to encourage that if the actual insurance doesn't cover some or all of the total hospital bill when all is said and done. And last comments are, unless she has a special enrollment period, she can't switch at this time. Typically, if you get more spending money or other higher benefits, you pay higher copays. Every plan has to cover the Medicare costs, but each plan can set the copay for that service. It's just a matter of where the plan puts the benefits. Lower copays typically have less over-the-counter benefits. Higher copays may have more benefits for over-the-counter. You just have to determine what's most important for her. Pay less at the doctors for services and get more over-the-counter benefits, or pay more for doctors and services and get less over-the-counter benefits. I highly encourage you to work with a licensed health insurance professional in your state, someone that you trust that will do the best for the client, not just switch plans to make commission. And that is just what I'm afraid of. I'm not good at deciding who should be trusted or not, as I usually give people the benefit of the doubt and then learn the hard way through trial and error. Now, when my mom got sick with cancer, she was in Connecticut and I was in Virginia. And since she had the incurable kind, she decided not to tell me until just before the end. That way I didn't spend all of my time worrying and trying to research for a cure or anything. And so I didn't ever see anything that had to do with her insurance or anything and how all of that worked. And my father and stepmom were always capable of handling their own finances and such. And my stepmom did a great job taking care of him and herself, or arranging for her niece to come help them when they needed it. So once again, I didn't have anything to do with their insurance or what their bills were, etc. Therefore, helping Helena has helped open my eyes to the next chapter coming up in my life, and is helping me ease the stress that I would be experiencing if I waited until I turned 65 and tried to figure it all out then. Hopefully, I'm helping someone out there in YouTube land who hasn't put much thought into Medicare or Medicare Advantage plans, and this video has helped open your eyes to some of the things to consider and look into. Now, my usual disclaimer probably doesn't really apply, but what the heck? I'm not a financial planner. I can't give professional or legal advice. I'm not a certified public accountant. I'm not a doctor, nurse, psychiatrist, psychologist, or even a scientist, in case I talk about health or other topics. I'm just a regular guy who's trying to figure things out as I head into and prepare for retirement, and I want to share my thoughts or things I've learned so that I can help someone else, maybe help you. The Bible emphasizes that helping others and the community is a core expression of faith, love, righteousness, often describing it as serving God directly. Believers are called to be generous, defend the vulnerable, and share resources without expecting recognition. Much like the people who responded to my post, Scripture instructs caring for the poor, orphans, widows, and strangers, viewing this as a sign of true faith. An act of kindness is not merely a feeling, but an action. Do not withhold good when it is your power to act. Believers are urged to bear one another's burdens, show compassion, and love each other as Jesus loved them. Encouragement is given to share resources, work hard to help those in need, and give to those who ask. I only asked for their knowledge, and boy, did they deliver. And I thank every single person who responded, even though I jumbled them up into a few paragraphs. Galatians 6:9 says, "And let us not grow weary of doing good, for in due season we will reap if we do not give up." And 1 John 3:18 says, "Let us not love with words or speech, but with actions and in truth." Well, I hope I've given you a lot of things to think about and useful information so you can weed through the crazy responses. Crazy because I jumbled them all up into a few paragraphs. And do some research and investigating on your own to find the best plans for yourself or your loved ones or someone that you're caring for. Again, welcome to Pre-Retirement Planning Without Savings. I'm Brian James, and I'll see you on the next one. Like, share, subscribe, and please leave some feedback. I am interested in hearing your thoughts. Bye now.